I came to work in healthcare as a nurse, mainly because of my mom. My mom was a registered nurse in the Philippines, and when we moved here, she now works as a healthcare aide. And it was either being between a teacher and a nurse, and I just thought, my mom is a nurse, I really enjoy being around people, and it just felt like that was something that had, like it was a meaningful career where I could connect with people, and so I went that route. Teacher was 5 years, nursing was 4 years. Like it wasn't this dream I had when I was younger. It was me trying to pick a way to go, and I went that way.
Have you ever felt like you've been treated differently because of your Filipino background working as a nurse in Canada?
I have been treated differently by patients. Fortunately, not in an overtly racist type of way, more like microaggressions. Like, where are you from? But where are you really from? And your English is perfect. And so those types of things.
So you said fortunately you haven't experienced necessarily being treated overtly differently because of your background. Have you seen that for someone else with your similar background?
I have. So in healthcare, there is that hierarchy where it's RN, LPN, healthcare attendant. So I think as an RN, I haven't experienced that, but I have seen that in my LPN carried partners, and especially the carried partners, where they are seen as less and seen as like domestic help, and that really bugs me.
Considering that Filipinos make up a sizable percent of the Canadian healthcare workforce, do you think they're acknowledged for their contribution?
I think that we are seeing, or I am anyways, starting to see a shift in that we are starting to celebrate different groups, and it's a slow shift, but it's coming, so that's positive. What I hope for the audience to walk away with after watching this segment is that racism, when we look at racism, and racism, it can be like individual or systemic racism. It often stems from ignorance, and ignorance to the history and the individual as a person, and like also individual like groups, and that lack of understanding. And so what I hope and what I invite for others is to treat individuals with a cultural safety or trauma-informed practice lens in mind, where it's not what's wrong with you and more of what has happened for you. And it can look like a lot of ways, where it's taking that extra time to listen and just meeting people where they're at.